all change as we get older, we know. And guess what? That's true for dogs also.
Just like people, as dogs grow older, they tend to have more health issues. Joining us with the signs that you should be watching out for, Dr. Eric Ruhland from St. Paul Pet Hospital and Butter.
Good morning.
Of course.
Good morning.
Good morning. Okay, we both have older pups, so we're really living this life right now.
Yeah.
You just made kind of a really important point when people ask you about changes that they notice, how you address that when dogs are aging.
Yeah, I think it's probably one of the most common questions that at least a lot of my friends ask me when we're out and about or when they bring their dogs over to visit Butter. They're constantly asking, is Lucy or is Sparky, are they just getting old or is there something actually wrong? And it's, as a veterinarian, my brain immediately clicks on when someone comes into my exam room and says, the things that, my dog's really slowed down in the last year. So there's some things that I want to talk about today that are really telltale signs that you should probably make an appointment with your veterinarian before moving forward over just thinking, oh, this is just aging change.
Sure.
And I remind everybody, and I'm going to drill this, all my clients hear this, age is not a disease. Age is not a disease. It is not, getting old is not in itself its own disease. Okay? So.
Okay. So what are some of the things then that we should be watching out for if we have older dogs? Like what are some of the top things that you're saying? Age is not a disease, so it's okay if they're aging, but there are diseases that we should be aware that could be possible?
There are specific diseases that we can treat that we can definitely intervene and have a better outcome quickly. I think about some of the metabolic diseases like diabetes and thyroid disease. Those things usually manifest in the beginning phases as changes in water and dietary intake. If I've got a dog, especially an older female dog, large breed dog, that starts to eat more ravenously, and they're gaining weight and they are asking and begging for more food, that's a telltale sign of a thyroid problem. And those dogs get really lethargic too. I think of a dog that I just saw a couple months ago. The owners had come in, they thought they're like, oh, she's been aging a lot over the last 3 months. And I said, I don't really think so. She looks totally fine. And I did some blood tests and we found out she had thyroid disease problem. And just a few weeks ago, they called and the dog's essentially normal.
Right, so it's treatable.
So yes, water intake and food intake, monitor and watch that. Obviously, a lot of people would know that, but changes in that are usually a sign of a metabolic problem going on.
Okay. We were talking earlier about she has a dog that vision is an issue with dog and hearing is an issue with my dog, and that's just those things that come with age, correct?
Right. There is a specific condition called lenticular sclerosis where a lot of owners, you look at an older dog's eyes and they kind of seem glossy.
Yeah.
That's normal. However, an acute change, and a dog will adjust for that over time, but what a dog will not adjust for is if it's a sudden loss of vision, you will have daytime running into things or bumping into things. That is obviously a sign that you need to give us a call. Or if they're constantly running into a door and they can't see that, we have to take a look at that.
Okay.
So the hearing thing too, I think Little King has also had a hearing issue for a while, and now that he's going blind, and I think he's fully blind now, you and I talked about this, I'm having to talk to him before I approach him because he's skittish with me now.
Exactly.
Will that continue or over time? I mean, am I doing the right thing by talking to him, by approaching him, because then he knows it's me?
Yes, you need to give him some room and you need to give him a little bit of a buffer. So the other thing I think we could talk about too is osteoarthritic diseases.
Yes.
A lot of dogs are, as they progressively age, they will have acute onsets of like a disc herniation. And when you see, obviously if something changes within a week, when your dog is not able to ambulate quite as well, that's something we got to look at. However, I have a lot of clients that have 13, 14, 15-year-old dogs that they think that their knees or their hips are their problem, and a lot of time it's a back issue. And sometimes some use of laser and anti-inflammatory drugs will help those dogs tremendously. I think a lot of people just say, oh, my dog is arthritic and old and there's not much that I can do. That's not really true. There's a lot of 70 and 80-year-old people that take an anti-inflammatory every day, and that's normal. That is totally normal. So we can have significant impact on those dogs. So
they're going to age, but we can help them
exactly
with that process.
Again, the age is not its own thing. Diseases are specific, and we can fix them. So.
What is the weight concern? I mean, how quickly do they need to drop weight for you to be concerned about that? And I have a small dog, and I know, so the big dogs, it might be different, I'm not sure.
Right.
But is it just visibly?
By the time an owner tells me or they can see that the dog is losing weight, that is normally, it's far enough along.
Too late, okay.
Yeah. If someone's like, oh, I can actually visibly see the dog's losing weight,
Not good.
They've already lost weight.
That's good to know.
They've lost enough.
Okay.
Yep.
That's really good to know.
And I'm just going to throw this out there too. We've been looking for homes and thinking about moving, but we have a dog that can't hear very well or see very well.
Yeah.
What's advice for people who might have to change an environment that a dog is very comfortable with and can't sense it as well?
I would say make the change, because the change is going to have to happen. I would say put them in a new environment, but do not change that environment once you have set it.
Okay.
And that's probably the best thing. There's going to be an adjustment period anyway. A lot of those dogs, especially when they're older, can really adjust pretty quickly.
Okay, that's good.
Yeah. So.
I know you mentioned joints. I'll just bring this up because my veterinarian talks about in small dogs, their joints really become an issue when they get older, don't they?
Yes.
And is there anything that we can do to help with that?
Yes. So there is a variety, like I was saying before, there's a variety of anti-inflammatory medications. Supplemental omega-3 fatty acids, laser treatments. There's a lot of things that we can do in the front end of the disease process. Probably the biggest thing, and I harp about this all the time, is weight management and making sure even these small dogs, I see these little sausage dogs that come in all the time, and they're walking on little toothpicks, and these are like
too much weight.
Exactly. We think because they're small, we're like, oh, that's okay, they're heavy. That's actually a much bigger problem. That dog is probably twice as big as they should be. So on the front end, obviously keeping their weight low, but your veterinarian is going to have a lot of recommendations for what specific treatments can we actually do. And I think, to kind of tie a bow on this whole thing, I think a lot of people just think their dogs are getting old, and again, when someone says that as a veterinarian, my brain just clicks on immediately. And again, we can do so much and impact so much for some of these senior pets, and especially, well, I won't get into vaccines and some of those other things, but again, we have a lot of options.
Can I ask one more question just real quick? Because I think sometimes we don't know if they're getting old versus have a disease. So can we just go over the signs to watch for in the dog if they're uncomfortable and not feeling good, just for everybody?
Yes. So I would say changes, again, going back to changes in diet and changes in food intake and water intake. Looking at fecal output and looking at that as well as a huge sign for metabolic changes. Changes in weight that are noticeable that you can see, and acute changes in ambulatory patterns and ability to obviously ambulate. Most people be able to pick up on those, but I think for the senior dogs, a rapid change over 3 to 5 days is significant. Like I said, a lot of these dogs have disc issues in their back, and like a lot of us that have a back problem, you can have an acute flare-up on top of a chronic disease. So you have this chronic disease where the dog is getting slower and slower, and all of a sudden one day it drops. Well, we can medicate and help that patient get back to where they were before.
So lethargy is an issue, but honestly, I feel like old people, he has good days and he has bad days.
Exactly.
And if he bounces back, I feel better. And is that okay if I see that pattern?
Yes. You're going to want to count those bad. I always tell my clients, like, especially in a really senior dog, you're going to want to count those good days and bad days. And when we start to quantify, more than 2 bad days in a week, that's when we start to say, that's when we start to talk about real end stage, end of life, type of things. And obviously we're intervening well before that, but that's kind of when we start to have those conversations.
Okay, great information. I know, we appreciate it. Living that life right now with our pups.
Thank you.
Dr. Eric Ruhland, thank you for joining us. If you want more info, you can head to stpaulpet.com. Butter